Hey everybody, welcome. Are you guys able to hear me okay? Go ahead and let me know in the chat if you guys can hear me okay. This is Hot Mama, how birth workers are using vaginal steam to improve maternal health. Because if you steam the mom, she's hot. Okay, cool. It sounds like the sound is good. Welcome to everybody joining us today. This is a topic I'm so passionate about, and my notes, I have a lot of notes. So I'm going to get started right away and start zooming through them and see how far we can get. Okay, so first and foremost, I'm Kelly Garza. I'm the owner of a company named Steamy. I'm the founder of the Steam Hydrotherapy Institute. I'm the author of a study called the Fourth Trimester Vaginal Steam Study, which was a small trial study that we'll talk about a little bit more. I'm also the author of another study called the Pelvic Steam Testimonial Database. I'm the author of the Vaginal Steam World Math. Oh, hi, Nava. Welcome, love. One of my friends. And I am the organizer of the annual Vaginal Steam Awareness Month on Instagram. I have the executive producer for the Hot and Steamy podcast. And I'm also an executive producer on an up and coming documentary about steaming. Right now, our working title is Steam, which should be released next year. Okay, so that's who I am. A couple more credentials. I have offered continuing education provider courses about steaming with the National Certification Commission for Acupuncture and Oriental Medicine, for the Midwifery Education and Accreditation Council, and for the California Acupuncture Board. Okay. All that aside, I have a master's degree in international development from American University in Washington, D.C. And personally, I've used steaming in a lot of situations in my life. I first found out about it in 2011. Somebody's asking what the speaker's name is. My name is Kelly Garza. So I first found out about steaming in 2011. And since then, I've used steaming to bring back a missing period, to help to get into labor when I was overdue, for postpartum recovery, specifically dealing with a prolapse, swollen skin, and a lochia infection. I believe that 3 fibroids, so I had 3 fibroids, and through steaming, I no longer have fibroids, and I believe that it's attributed to the steaming. I used steaming when I had a miscarriage, and for helping to help the miscarriage along, as well as to help with the recovery from the miscarriage. I've used it for a cyst, a labial cyst, and then for my daughter, for her, she had a paraurethral gland cyst. Okay, so that's how I've been using steaming in my personal life. And then I also have an online institute called the Steamy Institute, where I certify practitioners. Personally, I've worked with over 700 people. And what I do when working with people steaming is that I look at their menstrual cycle starting off, and then give them herbs based on whatever imbalances they might have. And then I followed my clients to see how their menstrual cycle changed over several different cycles of steaming. And doing that, I developed unique steam protocols and herbal formulations to deal with a variety of different issues. Okay, to date, I have certified 1,208 practitioners around the world. And some of them are here today. So welcome, everybody. Okay, so that is a very good, full introduction about who I am and why I happen to be here today. Okay, so the topic of this course, what I wanted to talk about are the benefits of steaming when it comes to maternal health. What I have seen is that out of all of the steam practitioners around the world, birth workers tend to play a really important role in getting steaming to people, to their clients, and also referring people to steaming. So I think birth workers play a really important role in steaming, or in being able to steam accessibility. I think is what, you know, is really on my mind, is how do you make steaming accessible to everybody? Doulas and midwives are really out there at the forefront of that. Okay, so birth workers are at the forefront of this. Now, I don't come to this field as a birth worker myself, but I work with a lot of birth workers, have certified a lot of birth workers, and personally have used steaming in my own, you know, maternal health situations. And so I'll share those stories with you guys along the way. But a story that I actually haven't shared publicly very often is how I first started using steaming for labor. So in 2013, I was having my first baby. And at this time, there was no information about vaginal steaming online. So, but I had used it to bring back a missing period at that time. And I used it monthly as a regular practice. So here I was, overdue. My doctor wanted to induce me even a week before I was overdue, and I wasn't wanting that. And so I was trying to figure out what to do, you know? And so I went overdue, and in my case, I actually stopped talking to the doctor. He told me to come back tomorrow, and I just never came back. I was like, I need to figure out how to get into labor by myself, because I already knew what he was going to do. And I had some issues with the doctor, and wasn't feeling all the way comfortable with the care that I was receiving regardless. So that was another element of what was going on. But here I was overdue, trying to figure out how to go into labor so as not to get induced. And more importantly, how to go into labor so that I don't go overdue so long that my baby is in danger, right? Which is ultimately what everybody is concerned about, you know, including me. So I didn't want the medical care that was being, I felt like, pushed onto me. But I needed to figure out an alternative myself without necessarily having any guidelines for that. So I steamed. I didn't know that I could steam during labor, but it made sense to me, right? Because there's like, when you steam, there's like an opening that happens, right? And when you need to get into prepare the body for labor, there needs to be, you know, again, an opening of the cervix, an opening of the vaginal canal, right? And so on. So I steamed, and I immediately started to have contractions. Now, this is, you know, don't take this and think this is going to happen every time somebody steams when they're, you know, when they're pregnant, for example. But in particular, when somebody's overdue, that's often something that might happen, is that they might start having contractions even while steaming. So that is what happened with me. I know that now from working with, you know, from working with people. But I did immediately start having contractions, and I delivered my baby 12 hours later. Okay, so I didn't continue to steam after that original steam. I did a very mild heat steam for 10 minutes. And with water only, because again, I just didn't have any guidance for what I should be doing, and I wanted to make sure that I was being careful. And so that's what happened. So I delivered my baby, you know, the contractions started, they continued, and I delivered a 10-pound baby 12 hours later without any tearing, which I didn't really understand the significance of that until later. But I will tell you about what we are finding when you look at the research of women who are delivering, who are using steaming, either during active labor or before, they're delivering without tears. Okay, so that is a huge benefit that we're seeing when people do use steaming during either pre-labor or during labor. Okay, and somebody's sharing. Shannon, hey Shannon, she said, I steamed 2 weeks before giving birth. My sister steamed once and went into labor several hours later. It helps when your body is ready. Yeah. And somebody else shared that she was induced 3 times and it was horrible with contraction storms. Oh, Georgia, so sorry to hear that. Yeah. So I'll share with you guys and people are asking about the herbs you use for labor. I am going to let you guys know to put all of your Q&A in the question box down below, because I have a lot of information to share. And so I won't be able to answer all the questions along the way. But also I want you guys to know that I don't consider steaming during labor or postpartum a do-it-yourself thing. Like what you won't walk away with from this is like a guide for exactly how to do it. There are practitioners who are trained in it, and there's an intake form. We take into consideration whether or not the person has diabetes, whether or not they have placenta previa, and a full intake of what the person's health is, and then what herbs would be necessary, and so forth. And I'll give you guys the information on how to get to that course and have that full information. But I definitely, it's not the kind of thing I recommend jumping into without a full knowledge of it, okay? Oh, yeah, somebody sharing their client is 42 weeks and she's really stressed. Induction is planned. Okay, great. So I'm glad you're here. I'm gonna give you the information for that, to get the information to possibly steam for her, okay? If she's interested in it. Okay, so that's my personal story. So I do have a class on the Steamy Chick Institute. It's called Vaginal Steaming for Labor Preparation, okay? And it's a single class, and the really nice thing about this class is that anybody can take it. So you can recommend it to your clients, or you can take it yourself to use it with clients, okay? Now that's the class that Shannon used, who shared about her personal steaming, and that's steaming with her family member. Okay, so for anybody who's interested, you guys can immediately go there, and it's on sale. Okay, but that said, a doula from the Czech Republic, Monika Valova, went through my class 4 or 5 years ago, and she started to use it with the midwife that she worked with. And the midwife was pretty fascinated and asked her to, with the results that she was seeing, and so asked Monika to speak at a conference for nurses and midwives. And then Monika was invited to train a maternity ward in the hospital how to use steaming during labor. So Monika went to the hospital, she trained the nurses how to use steaming and what the benefits of it were. And what the nurses do in the maternity ward is that if somebody arrives and they're in early labor, then they offer them the steaming as an option. It's there in the, near the shower. They use a geriatric chair, different things that are accessible in the hospital. And this maternity ward started offering steaming to their patients if the patients wanted, right? Just like, the shower is there, you can use it if you want to. There's a steam chair over here, you can use it if you want to. There's nothing was being forced on anybody. What they were finding was that the patients who chose to steam were delivering in record time, okay? So their labors, even when they were coming in early labor, very early, what they were finding is that they're having the labors are taking about 6 hours. Now, something that's unique that Monika does is that she actually steams during active labor as well to help to continue the labor progressing. So now they're having shorter labors. What they're finding is that when the people steam, they're having shorter labors. What they're finding is that they're having less perineal tears, I've talked to her several times and she said like 0, like they're not having the people who are choosing to steam are not having tearing. Like I think almost at all. I think there might've been one case of somebody who had prior scar tissue who tore, okay? And what they're finding is that the women are a lot more relaxed and able to deal with pain. Like, so it's playing the role as pain management as well. And there's one more thing. It's reducing the amount of transfers of medical intervention, of transfers for the need for a cesarean, of the need for, they're not seeing that the patients who are choosing to steam aren't needing medical interventions like the epidural, like Pitocin, transfer to cesarean. So it's actually really incredible. The first hospital that implemented steaming was raving about it and so impressed with it that another hospital wanted to learn how to do it. And so Monika trained another hospital and then another hospital. And right now, 1/3 of the hospitals in the entire country of the Czech Republic are offering steaming to their clients. And again, all of them are really excited about the outcomes that they're having with the steaming. And all of the birth workers in the country who deliver at home know about steaming. And I talked to Monica yesterday, and she was telling me about 80% of all of the home birth workers are using steaming as well. So you went from 5 years ago, almost nobody knowing about steaming at all, to now almost the entire country has steaming as an option for laboring mothers. The impact that this is going to have is incredible. We are trying to raise, Monica is trying to raise funds for them to be able to even study more about this, so that there can be medical research about it, medical studies that other doctors can read to understand the benefits of steaming during labor, of course. But what we have right now, we have the stories and we have the reports from the people who have tried it, right? Myself, including some of the people here, and then looking at what is happening in the Czech Republic. And that is one of the things that for the STEAM documentary that's coming up next year, we're going to take the film crew to the Czech Republic so that we can see this in action. And I'll send you guys some pictures when I send out the replay afterwards. I'll send you guys some pictures of this steaming in the hospitals in the Czech Republic. Now, I share all of this to share it because the way that steaming is presented sometimes in the United States is just kind of like this woo-woo thing that doesn't make any sense, that, you know, maybe like some famous actress does. And the thing is that steaming has been practiced since the beginning of time. And since all of the earliest records of women's health care, you find records of steaming. And it didn't go away because it wasn't useful. It basically went away when you had a transfer of women's health care being in the hands of women, you know, midwives and female physicians kind of transferred into the care of men pretty abruptly because of some laws that changed in Europe several hundred years ago. And at that time, steaming kind of died down and died out and went out of knowledge. And so now we have this return and this remembrance of this practice. And there's several places in the world where it has maintained common practice. And those places are great to be able to look at and see how steaming has been used. But one of the most common uses of steaming worldwide, and there's no part of the world where steaming hasn't been used historically. One of the most common uses for it is in birth work, mainly postpartum, but there are certain places where it was also used during labor. But at this time, when reclaiming and uncovering this practice of steaming, what's so cool is being able to learn, for example, that in Germany, steaming was used for labor induction. In the South Pacific, in Palau, it's used for postpartum care, right? And to be able to say, oh, okay, cool. Well, here it's just used for postpartum, but we can use it for labor as well, right? And that's one of the things that's happening right now in the information age, is being able to see how steaming was used all around the world. And so that's what, if you're interested in more information about those records of steaming around the world historically, you can check out the Vaginal Steam World Map. And again, my website is steamychick.com or steamychick.institute, and you can find all these studies and all this information there. Okay, so the cool thing about steaming for labor, there's not a lot of training that is needed. When it comes to steaming, when somebody's, has their menstrual cycle, you kind of have to look at what kind of menstrual cycle they have and what kind of herbs are going to be best for them. But when it comes to steaming for labor, there's only one thing that you're going to do. You're going to steam, and hopefully a baby's going to come out, right? Now, it's not an induction. So I recommend steaming, but it does help to prepare the body, okay? So if the person isn't ready for, if the body's not ready for labor, doing a steam session is not going to cause, the person to go into labor. But it does help to give the body the necessary requirements to go into labor. It helps to relax the muscles, and it helps to bring some moisturization. It helps with the elasticity of the cervix, okay? It might help the mucus plug. To be able to loosen up and get ready to clear out, okay? So it helps to it helps the body to get ready in the same way that a hot shower might be relieving to the body. But this is something that's a specific treatment for, the vaginal canal and the cervix. It helps to, to get them ready and bring circulation to that area. Okay. So there's not a lot of training that's needed. This is I do have a standalone course that birth workers can take themselves to be able to work with their clients with steaming, or be able to refer their clients to the course. Just a couple of days ago, I found out that one of my friend's sister is 40 weeks and is trying to figure out how to avoid an induction. And I was like, are you kidding? Is she steaming? So I sent her that class. And yesterday I found out that she was not induced. She started seeing her dilation in like the same day that she steamed. She started to see her dilation progress, and that progressed into giving birth. And she says she almost didn't have to push at all. The baby kind of just came right out. Okay. So those are when you're hearing and learning about the cases where people steam before or during labor, there seem to be a lot of benefits that go along with it. And she also didn't have any tearing. It was a pretty big baby, almost 9 pounds, and she didn't have any tearing. So this is kind of like, what those of us that are aware of steaming and have seen steaming in labor are aware of. And that's one of the reasons why I'm having this webinar, is that I think everybody needs to know about it. I think all birth workers should know about it in the United States, just as they all know about it in the Czech Republic, and have either the knowledge of how to steam yourself, or have somebody on the team, somebody that you can call in or call on the phone in situations where steaming might be necessary. Okay. Okay, so then for postpartum, let's talk about steaming for postpartum. Postpartum, when you look at steaming all around the world, is like the most common use of steaming. Okay, so like there are a lot of places in the world where steaming is used for postpartum, and it may not be used for labor, it may not be used for fertility, but the most universal use of it that I can find worldwide is for postpartum use. So after I had my big 10-pound baby, I was very swollen, and so I steamed. And what I noticed was that swelling went down immediately. I also had prolapse, like a stage 3 or 4 prolapse, and I noticed that the prolapse improved immediately. And so I steamed consecutively. Ideally, people will start as soon as possible after giving birth with the steaming, like the same day of, for example. But people always like to ask, like, how many days postpartum can somebody steam? And what is important to understand as I'm sharing this story is that sometimes somebody can steam immediately after giving birth, and then maybe 1 week later they're contraindicated, and then maybe they can steam again, and then maybe they're contraindicated again. Okay, it really depends on what's going on with their uterine bleeding, and it's really important to have a practitioner who's trained in like being able to read the uterine bleeding and understand the contraindications to steaming versus when it's safe. Okay, so that said, I started steaming immediately. It was safe for me to steam. And within 10 days postpartum, or by my 10th steam session, my prolapse was completely resolved, and my skin, my labia, everything had returned to almost what looked like its pre-pregnancy state. Now I say that with my first baby. This was in 2013, and I wasn't really sharing any information about steaming, and I didn't take pictures of it. I do have a picture of 30 days, and you can see that, for the most part, my body looked like I hadn't had a baby. And I really attribute that to the steaming. But with my second baby, I had a midwife do an exam on me, a vaginal exam. And she, I think I was 6 days postpartum. And she was just like, I've never seen anything like this. She was like, there's no signs that you've had a baby. And I was like, yeah, okay. That's what I remember, from the first baby as well. But then I had the information from the midwife. And this is one of the things that we looked at a couple of years later. I crowdfunded and I did a trial study called the 4th trimester vaginal steam study. And one of the things that we did was a visual exam of the labia in order to see what the difference of a steam user versus a non-steam user had. And so with my second baby as well, I did end up with a lochia infection like there was discharge and it just started not to smell right and it started not to look right, like very yellow and just odorous, you know. And so with my second baby, I didn't steam as much because it was really hot weather. It was extremely hot weather. And so I had steamed maybe 2 or 3 times the first week, and then I stopped steaming and I ended up with that infection. So again, you know, normally you would have to go and take antibiotics. So before I went to the hospital, of course, you know, I tried steaming. And so I steamed and immediately saw an improvement. And then I think I steamed like twice per day. Steaming for infections is also another class that I do. And by the second day, the infection was completely cleared up. So I never ended up needing to go to the hospital to do, you know, a round of antibiotics. Yeah. So, so that was my experience using steaming postpartum. And this is actually when I started sharing steaming with others, because when I would hear what was going on with my mom friends, I would just be like, have you tried steaming? Like maybe steaming would help. And that is when I started to share information outside of what I was doing in the home with others. So when my friends would have babies, I would take steam supplies, you know, and set up a steam session for them. And then you know, basically that catapulted into my friends telling their friends and people wanting to get steam sessions or buy herbs or, you know, buy a steam chair from me. And that's actually how I started Steamy Chick. I didn't actually start this company. I say this company started me because I was getting all these text messages and calls from people who were asking for steam supplies. And at that time it was like, I didn't have like a full understanding of what was going on with maternal health, but I did really start to see that there was a need, that people didn't seem like they were getting the care that they needed postpartum and weren't recovering as robustly as they could postpartum. And then it also is when I started to become aware that there were a lot of people who maybe hadn't fully recovered postpartum, you know, that were dealing with incontinence or dealing with prolapse. And this is just something that they continue to deal with. And hasn't ever been addressed or even been recognized as a problem. And it was just so vastly different from what happens when people steam postpartum and they seem to get put all back together again, right? So, so a couple of years later, I crowdfunded and did the 4th trimester vaginal steam study. And this is just a tiny little trial study. And trial studies are something that are necessary in order to get other studies done. I've talked to researchers, I've talked to doctors. They all want to do studies, but without a trial study, they can't even get any funding for a study, okay? So for those that are here, you know, from the medical field, if you share this study with people, they might discredit very, very quickly. But what's really important to understand is that even in order to be able to have these studies in the future, number one, these studies need to be designed, and then there need to be trial studies, even to be able to get funding for an initial small study, to be able to get funding for a bigger study. That's how studies work, okay? So with the 4th trimester vaginal steam study, we looked at 15 different indicators. We hired a midwife who did steaming on a group of, she had 2 groups. She had the steam group and then a non-steam group. And so what she did was she did exams on both groups on days 4, let's see, at day 4, day 8, and then at the 6 weeks. So we had her look at them, you know, 3 times. And so she looked at everybody. And then half of the group steamed and half of the group didn't steam. We ended up with 11 users. So we had, I think, 5 in our steam group, or 6 in our steam group and 5 in our non-steam group, okay? So, so the steam group, she did the exam on day 4, and then they steamed on day 4, 5, 6, 7, and 8. And then she did the post exam, okay, after that. Okay, so they did 5 days of steaming, and she and her assistant administered all the steams. They did all of the steams for the same length of time. They used the same equipment, and they used the same herbs for everybody, so that we had, you know, a controlled environment of the steaming, okay? So this is what we found. Oh, okay, so she measured their blood pressure and pulse She measured their uterus height and width. They call it the fundal height and width. She measured their waist size and weight. She looked at the labia, the form of the labia, and then also the swelling of it. She looked at the lochia, color, and quantity, which is the discharge. She looked at the sutures, the stitches. She looked at uterine contractions, bowel movements, and hemorrhoids, urination, and incontinence. Okay, so these were some of the things that she was looking at with both the STEAM and non-STEAM group. Okay, and so what we initially found was that the STEAM group kind of blew the other group out of the water in these areas. Okay, so they had a more speedy return of their vulva back to its pre-pregnancy state. Okay, so the STEAM group by day 8, their vulva again had gone back to its pregnancy state. There was no swelling. Our non-STEAM group still had swelling at that time. Okay, our STEAM group expelled the lochia much quicker. By day 8, there was only a tiny bit of lochia in its final stage, and by 6 weeks, there was no lochia at all. Our non-STEAM group was actually still dealing, I think over half of them were still dealing with lochia at the 6-week mark, and all of them were still dealing with lochia. None of their lochia was in its final stages by day 8. They were in their first and second stage of the lochia. They have 3 stages, whereas our STEAM group, all of their lochia was actually approaching its final stage. Oh, this was a really interesting finding. The blood pressure and pulse went down for the STEAM group. Okay, so now not down to a dangerous level, all within healthy. Actually, just by chance, our STEAM group started with a higher blood pressure, which is something that's common after giving birth. The blood pressure will be higher. And by 6 weeks, everybody's blood pressure had gone down. But what was interesting was that by day 8, our STEAM group's blood pressure had come down and had started, like on average, every single one of their blood pressure was lower by day 8 and was coming down to a healthy range or the average range. Whereas our non-STEAM group, all of their blood pressure had actually gone higher and was getting closer to an unhealthy high. Still within average, but everybody's was going up. And our STEAM group, everybody's blood pressure was coming down, which is just an incredible finding because eclampsia is one of the causes of, postpartum or maternal mortality. And eclampsia is characterized by really high blood pressure, right? So preeclampsia is like when somebody has high blood pressure and they're being monitored. So we didn't have people with preeclampsia in our group, but what we saw was our STEAM group was going away from, the risk of preeclampsia, and our non-STEAM group was going towards the risk of preeclampsia, which was just a fascinating finding. With our STEAM group, the uterus shrinks back down below the pelvic bone in a much shorter time. The STEAM group, they had an accelerated waist and weight reduction. Okay, so by day 8, the waist size and the weight had already started to decrease, and by the 6 weeks mark, they still had lost more inches off of the waist collectively and lost more weight collectively, and that was also true for each individual. Whereas the non-STEAM group, they never lost as much weight by 6 weeks. By day 8, they had actually increased in waist and weight. And then by 6 weeks, they had started to lose, but they never caught up with our non-STEAM group. And somebody's in there saying, in the chat saying, there's just so many benefits. And I'm like, yeah, that's the point of this, it's just really to share what the possibilities are here, and what information we do have to date. So our non-STEAM group, our STEAM group actually by chance, just by chance ended up with, actually everybody in our study, almost everybody ended up with stitches. I think there were only 1 or 2 people that didn't. And we had, everybody in our STEAM group had stitches, and there were a couple people in our non-STEAM group that didn't. Our non-STEAM group sadly continued to deal with the discomforts of their stitches we characterize itchiness, tightness, pulling, or tenderness. They continue to deal with it at 6 weeks, almost all of them. Our non-STEAM group was completely, they had a lot of discomfort on day 4, and they didn't report any discomfort at day 8 or at 6 weeks. So they were completely able to dissolve the discomfort of the stitches within those 5 days of steaming, which is pretty incredible. Okay. Our STEAM group had better bowel movements, and our STEAM group had a lower instance of the hemorrhoids, postpartum hemorrhoids. Okay, so that's what we found during the tiny little trial study of the 4th trimester vaginal steam study. Okay, and so I personally, experienced a lot of those benefits, and I think there's a lot of people here. You guys go ahead and raise your hand, or feel free to share your stories in the chat of what you experienced if you were able to do any postpartum steaming. Okay. That said, there are also some benefits of steaming. When we did the 4th trimester vaginal steam study, we were talking about the immediate postpartum, but there's some benefits later as well. So what you see is with the steam users, you can use it to help deal with scar tissue, even if that's scar tissue from births of the past. If there's scar tissue, even during the postpartum year, the steaming is really helpful. Honestly, it gets rid of the scar tissue. People who steam, with steam users who have scar tissue, it kind of gets the scar tissue completely gone. Like people who steam and who dedicate to the steaming that it requires for the scar tissue don't end up with that leftover scar tissue. This is also really important when it comes to returning to sex and being able to have pain-free sex postpartum. And then also with my practitioners, we deal with the menstrual return. So the way that I define postpartum and postpartum recovery goes all the way until the menstrual cycle returns, because when you have that first menstruation is when you could see whether or not there was a full uterine cleanse postpartum, which is supposed to happen, right? All that loci is supposed to clear out. Well, when somebody has that first period, you see, it's filled with clots, and other issues, then that means that that person maybe had not gotten that full uterine cleanse. So my practitioners, for example, we work with people even during the menstrual return to make sure that somebody gets back to a healthy menstrual return. And then at that point, we could say there's been a full, recovery. There are ways to use steaming if somebody's period returns just way too early, like some people get their period 1 month. There are ways to use steaming and specific herbs that can help that menstruation to delay maybe another 2 or 3 months. Sometimes, again, sometimes it works, sometimes it doesn't. If somebody's menstrual cycle is really meant to return, then it will. But a lot of times it's not actually a menstrual return. It's uterine fatigue bleeding from the uterus just being exhausted. And then also there's late menstrual return, right? There's people who never get their period back, or, they're going on 2 or 3 years and their period hasn't returned. Steaming is very helpful in the cases of late menstrual return as well. If the person wants it back, steaming is going to bring it back. Okay. So Kit, oh, hey Kit, how are you? She says, yes, I steamed for labor prep and for postpartum. I had 1 single tear and it was 2 inches. I haven't heard about your birth story yet. And I chose not to have stitches, mostly because I trusted my steam plan would help with the healing. And a few weeks later, I was all healed, and my midwife was very celebratory of the healing, as was I. Yeah, I recently heard that from another midwife. She's like, in cases where I used to stitch people, she's like, I don't now if they're steaming, because what she sees is that they're able to heal up with that. It's pretty incredible. Congratulations, Kit. So, again, you will see, there's not a guarantee that there will be no tearing at all, but there tends to be less tearing, okay? So what I want to share about postpartum steaming is that there is a lot of training that is necessary, because there are a lot of different situations that can happen postpartum. So with postpartum, because bleeding, uterine bleeding can be a situation, well, steaming is contraindicated during uterine bleeding, but there's some postpartum bleeding that the steaming might be okay, and then there's some that it wouldn't be okay. There's also cases where somebody is cleared to steam, and then all of a sudden they start having uterine bleeding a couple days later, or a couple weeks later, and they need to stop steaming. So postpartum steaming, unfortunately, unlike the steaming for labor, it is something that requires a lot of training, and we actually need fully trained steam therapists who know how to differentiate the herbs, who know how to create the different herb formulas, who know how to read the uterine bleeding and know when it's contraindicated, what the sensitivities are, and how to adjust all the steam plans accordingly. Over the, my practitioners are trained to work with somebody from the birth all the way until 3 healthy menstrual cycles. Okay, so basically like a 2-year, 1.5 to 2 year period. Or length of time, and they need to be able to, there's certain, we deal with different stages postpartum. So we call the first 30 days stage 1, and then we have stage 2 is from 1 month to 9 to 12 months. And there's different herbs needed during this stage, and then there's different stages, herbs needed during 1 year postpartum, and so on. And so there's just so much complexity to it. We just really need fully trained steam therapists for postpartum. So for all of the birth workers here, what I want you to take away from this is, if you want to use steaming and you don't want to dedicate to a full training, my training to become a steam therapist has 32 courses in it, 32 modules, and it takes anywhere from 6 months to 2 years to complete. It's a full training all and like in and of itself. And you have to learn how to treat all of these different situations, but you will not just be able to steam in postpartum, you'll be able to steam for menarche, first periods, and fibroids, and fertility, and all these different things. But you can't really just focus in on the postpartum steaming like how you can with the labor, because postpartum steaming also might have fibroids, right? It also might have infections. It also might have uterine bleeding. It might have a short menstrual cycle. Like, you have to know how to treat everything in order to work with somebody in postpartum. So for any birth workers who are now aware of the benefits of it and interested in the benefits of it, you want to kind of treat it like your lactation specialist. If you're not a lactation specialist, you have one that you can refer your patients to, or one that you can, call in the situation. That's how postpartum steaming should be. You want to have a qualified steam therapist who can deal with the postpartum steaming, that you can call in, or that you can call for a consultation, or that you can refer your client to. And we also need more birth workers who want to go in and do this training and just understand that this is not just, you can't just skip to the postpartum class. Like, you have to learn all of the foundations, so that way you know the contraindications and the sensitivities and can recognize those in the postpartum situations. Okay. So Leah shares, my first time steaming was postpartum. A nurse caused a small labia tear that also wasn't stitched up well. By the time I was able to see, it had already scarred, and I could feel it all the time. My first steam made everything feel and look better. Oh, I'm so happy for you. Yeah, that's something that honestly, I was sharing it with one of the executive producers of the Steam documentary the other day about what people were finding with the steaming in the Czech Republic, about just how relieving with the pain management and even preventing tearing and so forth. And she said, if that's true, she said, it's a human rights crisis that this isn't being offered to all women, during labor. And, those are strong words, but I really understand and feel that way, that, if this is something that can decrease complications, decrease discomfort. I mean, dealing with, the end of pregnancy, the labor, and then those first days after, like, steaming should absolutely 100% be one of the things that the birth team has on hand to be able to provide comfort, if anything, just that comfort. And there's nothing that can really speak to that. I want to say that I steamed for 2 years before my first postpartum steam, but that was the steam of my lifetime. Nothing compares to the relief that I got when dealing with super swollen skin after pushing down a 10-pound baby and prolapse. There's just nothing like that steam session. That steam session felt like it saved my life, right? And I steam all the time, and it's whatever, I'll be on my phone, text, it's not like anything, significant, but that postpartum steam, yes, and Georgia adds, and it's so simple. And then Leah says, amen to that, all right. So we're gonna get steamy to the birthing world, which is what we need to do. It's what we really need to do. Okay, so we talked about the postpartum steaming. All right, we're gonna move on to steaming for pregnancy loss. Okay, so I got pregnant with a third child after my second, and I got to about 3 months and I forgot that I was pregnant. Okay, so that's actually one of the signs that they say is problematic. But I forgot that I was pregnant, and then I started spotting. And so I called the midwife, and she said, okay, well, spotting is, it's something that happens, like just wait a few days. So then the next day, it was a lot heavier. And so she came and she said, okay, she said, I'm sorry, but you're losing the baby. I said, okay. So I continued, several days. It was a lot, it seemed like a period. And there was a lot of cramping, and so it was finally like, time when I was like, okay. And then I stopped bleeding, but I don't feel like it was done, So anyway, so I had my husband and mother-in-law take the kids, and I steamed. I stayed home by myself and I steamed. I took a hot shower, and then I started having crazy heavy contractions like I was giving birth. And I gave birth twice, but at this point, nobody tells you that this is what's going to happen during a miscarriage. And this was only at 3 months along, or maybe 3.5 months. I didn't expect that to really have contractions like that. I'm like sweating and going through all the stuff that I went through during labor. And so I did that steam. That steam is what initiated these contractions, right? And then within like an hour later, I saw the pregnancy matter clear out, and it was like, I don't know if you guys want to know, but I do think it's important sometimes to share this stuff, because nobody warns you. I think again, for labor, I was prepared for contractions, but during this miscarriage, I wasn't. I felt like a lot more like, discombobbled, It's like, at some point I was like, oh, okay, I'm going through labor. I need to breathe, and then it kind of got better, but there was like a big sac that passed that was gray. And then you could see like this sweet little, like kind of looked like a, seahorse, like it was the actual fetus. And so the midwife came and she confirmed, okay, this was the fetus, and the miscarriage was complete. But what was interesting was that it reminded me, so fast forward, when I did start, educating about steaming, this one woman came to me and she wanted to try steaming, and she told me that she had a miscarriage 3 weeks earlier, but now the miscarriage was done. She had gone to the doctor, she had taken some pills, and the miscarriage was over, and so she wanted to steam to recover. So she starts steaming, and then this is what she emailed me. She said, "Hey Kelly, I've been steaming for the past 3 nights. It's been really relaxing, and I sleep like a baby afterwards. This morning I woke up in terrible pain. I thought maybe my period was finally coming back, or maybe I had food poisoning. As you know, I've had really bad menstrual cramps my entire life, and in addition to that, a miscarriage about 3 weeks ago. I suffered really bad cramping on 3 different occasions, passing really large blood clots, which I assumed was the sac each time. Today, the pain was much worse. I eventually passed what I think was the fetus and a huge blood clot. Okay. This has been very painful for me on a few different levels, but I can't help think if I had not been steaming, how long would that matter have lived inside my body? I'm super emotional, yet relieved." And this was my first time when I was like, wait a minute, what's happening when people say that they miscarried and that the miscarriage is complete, right? Like, she thought that the miscarriage was complete. Her medical doctor told her that she had miscarried and that it was complete, right? Nobody was now checking for her. She was 3 weeks later. She was supposed to be past the miscarriage, and then she steamed and then went through that experience that I had gone through, once I knew that I was miscarrying. and steamed and had that experience. So a really, you know, a really interesting thing. Now I have a class on steaming for pregnancy loss, and it's something that my trained practitioners are able to do. Unlike the postpartum steaming, steaming for pregnancy loss is even another level of more complexity. So again, it's only something that fully trained steam therapists that I recommend for a fully trained steam therapist, because it can be dangerous. Miscarriage itself carries the risk of hemorrhage and is actually one of the leading causes of maternal mortality. So please don't anybody play around with it. Like, work with and refer to a steam practitioner who is trained to work in this situation. But that said, how many miscarriages are incomplete miscarriages? A lot. What happened was, when I started offering this class, and then as the practitioners started to go find practice clients and work with them, one of the things that happens so commonly is that somebody who believes that their miscarriage was complete all of a sudden passes the fetus. You know, and they're like, oh no, this is the fetus, right? This is the sac, right? And somebody's saying, thank you, Kelly, for sharing experiences of steaming and pregnancy loss. This is so crucial. Yeah, and it's just like over and over again. I want to say it's over 50% of the people who are steaming post-pregnancy loss end up, once steaming, actually seeing the matter come out. And this is in the case of a DNC. This is in the case of when somebody has used the pills. This is in the case of when somebody is under the care of their doctor. It's just really incredible to me how even in all of these medicalized situations, like often the pregnancy matter can be missed. And so it makes a little bit more sense to me. We're going to talk about causes of maternal mortality later. But one of them is, a huge one has to do with pregnancy loss. And it makes more sense to me why you would have that. Anytime that matter doesn't come out, the person is at risk of hemorrhaging, and hemorrhaging is the leading cause of maternal death, right? So I feel like, a lot of just, I don't know, I feel like a strong feeling talking about this, but it's something really serious, right? And something that we all have to be aware of, and then know that steaming could be something helpful in this case. I was working with another woman I had on here to share with you guys this story. She had 2 miscarriages. She had two miscarriages within the previous year, and her most recent miscarriage was six months ago. Okay, and she at the time when I was working with her. And she hadn't had the return of her period. Her period was missing, okay? And she wanted to get pregnant, and so she wanted me to help her get her period back because she had this missing period and she wanted to get pregnant. So I had her steam, and again, about five steam sessions later, she started to contract, and she passed the pregnancy matter. So this was 6 months ago that she had 2 miscarriages. Both had been involved with her doctor the whole time and followed all the recommendations and everything. So 4 weeks after she passed that baby, her period returned. So that's kind of that actually leads into the discussion on fertility. This was I was going to share some of these stories, but that's where, again, if you haven't recovered properly postpartum, even when that's post-pregnancy loss, then that's going to become a fertility issue. And so it's just really incredible to me. I think it's something that it would probably have like a public health crisis if we were to really look at it, as far as the amount of incomplete miscarriages. And then again, once I was looking at those numbers, I was looking at some statistics on the causes of mortality, and pregnancy loss is actually up there. It's actually pretty high. So, so that entire 6 months, that person could have gotten an infection, which is one of the, main dangers, and she could have actually ended up with hemorrhaging. So those are 2 of the main dangers of mortality that could have happened during that time period. So leaving people with incomplete miscarriages is not okay. It's dangerous, right? Oh, that's really cool. Georgia's sharing that her gynecologist is super open and interested in steaming and sends her his patients who he tried to get medical help and it's not working. Oh, that's really cool. And so she's able to actually go to his private clinic and take her setup there and work with his clients, which is really amazing, or his or her clients. This is what I want to see. I want to see, I think that like gynecologists and steam therapists should be like dentists and dental hygienists. You know, like there should just be one on hand, one that comes into the office every Friday that you could book those appointments. You know, like it just makes sense for these two to go together. Okay. So the other fertility story that I was going to share. So the discussion on fertility just in general is just a really big one. I'll have to do a different talk for that one, but I'll share the second fertility story. It was somebody who had already 2 failed IVFs, and then she was going to attempt her 3rd and final IVF. And so I talked to her. She was like, I just want to do all the things that could possibly help, this be successful this time. So I interviewed her, and I learned that her menstrual cycle, her menses was black and had always been black. Like she said that maybe it had been red or like purple, like and fresh when she was a teenager. She was like in her early 30s, but it had been black for a lot of years. So her menses came every 3 months, maybe. It was irregular, but maybe every 3 months she would have a menstruation, and it would just be only black blood. So what that means to me is that her uterus is packed and filled with old menses, because blood turns black when it's old. Okay, brown and then black. So I was like, wow, no wonder the IVF isn't working, right? You know, like with fertility medicine, they're looking at a healthy egg and healthy sperm. And then they want to get them together at the right time when the hormones are, at the right level in the body. And that's just an oversimplification, but, that's in general what's going on, right? Well, right after you get them together into the uterus, they implant into the uterine wall. So if the uterus is filled with black blood, old menses, of course that's gonna, to me, that just logically is going to interrupt the implantation, right? And then even if you have implantation, you're going to have, there's the higher possibility for a pregnancy failure, right? Because the placenta also grows into the, or it's like on the uterus wall, right? Interacts with the uterus wall. So like your uterine walls are important to fertility as well. And you don't want to have a bunch of old menses in there. So I had her steam. She steamed. After several sessions, she had a period. And all of this, she reports that all of this black goo came out. And then after the black goo came out, she had fresh red blood. And she was just like, wow, all these exclamation words. I've never seen blood so beautiful, such a beautiful color, cranberry red. I haven't seen blood like this since maybe my first period when I was a teenager, and she was just like all this. And she was so excited. And she told her doctor stories of doctors who aren't very supportive. And he was like, what, you had a period? He's like, all right, I'm going to put you on, I want to suppress your period because we're trying to regulate your, hormone levels and when we're going to do this next transfer and blah, blah, blah. So I don't know. He suppressed her period. He wasn't excited at all about it. So anyways, she did her IVF, and the IVF was successful. Of course it was successful. You cleared out that menses. You helped with the uterine walls. You helped with the health of the uterine walls when clearing all that menses out. So anyways, I just wanted to share that story with you guys as well. Fertility is, again, something for a steam therapist. So just for all the birth workers out here, please have a steam therapist on call and that you can refer to. And if you guys are interested in learning how to do all of these things, I welcome you to my program. So the last note I wanted to say about fertility, what's the last note I wanted to say? The really important thing about birth workers, I really love birth workers. I really feel like you all are spreading the word about steaming faster than anybody else out here and making it accessible to people who wouldn't otherwise try it or know it exists or have accessibility to it. So people, when they're not getting pregnant, they do ask their doula or they do ask their midwife about it. So that's why I just want to share a little bit, about how steaming can be useful for fertility. That said, what I have found with the majority of people who have come to me who have unexplained infertility is that they also have stagnation, like they have old menses in there. And a lot of times, but anyways, clearing out that old menses is an important part of optimizing their fertility. Okay. Okay. So I want to talk about specific situations where steaming can be used as emergency first aid. Okay. So number one, stalled labor. So stalled labors happen. Somebody starts their labor, their contractions stop, and they're just like there. And the longer that their labor is stalled, the more danger that there is to the baby. And for an infection, and for birth workers, help me out. What's the meconium? This is the meconium that might happen in the womb. So anyway, so it's a problem when labor stops. It becomes a complicated, it becomes a problem, right? And so you also don't want the labor to be stopped, for that long. So one of the uses that steam practitioners, or birth workers who are trained in steaming are using steaming during this situation of the stalled labor. A lot of times when the labor is stalled, it can cause the contractions to start immediately while steaming. Or an alternative thing that happens, when I worked with somebody who she had a stalled labor, a doula called me in, I went there with my steam setup, and so she steamed, and then she was so tired and she went to sleep. Then she woke up with contractions a few hours later and had her baby, and so that was another variation of what you might see. But with the stalled labor, like when labor is stalled, when the contractions have stopped, like you want to get the steaming immediately. And this is why I think, and this is why it's important. Like I just happened to be nearby and was able to come. But this is why it's so important, I think, for steaming and the knowledge of how to steam to be in the birthing room with the birth workers, right? Whoever is attending to that birth. And there's ways to steam, and I teach it in my program. Even if you don't have any equipment, there's a way to figure out how to get a pot and to do a steam in that kind of situation, right? In the case of in the hospital, what would happen if somebody's labor stopped? Birth workers, feel free to chime in here, but I think that's usually when you would, the person might end up with that Pitocin, and those really strong, going to lead to those really strong contractions. And you usually need to have that and, mixed in with the epidural, right? So anyways, you're increasing your interventions, you're increasing chance of risk. Okay, here we go. So hey, Christiana, hey. So she says, I had a client who had an on and off, again, labor for 3 days. Well, I'm a doula and a student of yours, so I knew what to do. We steamed, and the next day she had her baby girl in her arms. That's so cool. Congratulations with that. Yeah, it's so important for the birth workers in the room, to know how to use steaming. Like this is something I just think it should be, again, you're always going to have access to water and a way to heat up that water. And if you can do that and steam in one of these emergency situations, we can improve birth outcomes, right? The health of a healthy mom and a healthy baby, right? Okay, so active labor. Sometimes people are in active labor and they're contracting like crazy, but the cervix isn't dilating, okay? And so that leads to either the epidural, which, and then the Pitocin, and then a cesarean, or can end up in the cesarean, right? So in active labor, when the cervix is not dilating, again, this can be a situation where if the person steams, that they see that a lot of times we'll see that cervix will dilate very quickly. And steaming can be used consecutive times, actually, and continue. Like in this situation, again, if they're actively contracting and the cervix isn't dilating, you can continue to use it and actually get that cervix to open, which is, again, really, really important. And again, where a situation where we need the people in the room with the birthing mother or the birthing mother herself to understand how steaming can use in this situation, okay? If in a fix, okay? Preeclampsia. So this is the high blood pressure, and it can happen during pregnancy, and it can happen postpartum. And it's dangerous. It's one of the things that leads to mortality, okay? So what we found was that during the 4th trimester vaginal steam study was that the steam group, that their blood pressure came down quickly. And it came down very quickly. After just 5 days of steaming, their blood pressure was much lower than it was, initially. And so, I don't know how that has to do with the relaxation or what's going on there. We don't know how or why that worked, but we do know that that's what we found. So, when dealing with preeclampsia, if the person's full term, so at the final weeks of their pregnancy or postpartum, again, the steaming can be something that can help to de-risk, to like take down the risk of that eclampsia, bring down that blood pressure. I would love to see a study or, even a trial, of people who do have preeclampsia and the effect of steaming. We don't have any information like that. But I do think there's no reason not to try it. And I have heard case studies of people who have preeclampsia who use the steaming to help manage it and see that their blood pressure comes down after steaming. So placenta, okay, so another situation where steaming can be used as emergency first aid. If the placenta does not release after birth, okay? So if somebody's got to give birth to the baby and then they have to deliver the placenta. And if the placenta doesn't come out, the longer the placenta doesn't come out, the longer the person is at risk of hemorrhaging, okay? So like heavy bleeding. And this is actually the leading cause of maternal mortality worldwide and in the United States is hemorrhaging, okay? So it's becomes more and more dangerous the longer the placenta doesn't release, okay? So one of my steam practitioners named Chantal, she's on Instagram at Honored Womb, and she's really great. She delivered her baby, she delivered a baby last year, and the placenta didn't come out. And so the midwives were, quite concerned about it, or sorry, she became quite concerned, the people at her birth. And so she got out her steam box and she was like, okay, it's time to steam. And so she was able to set up her steam session, do her steam, and then the placenta immediately came out. Like, right on the, she basically had to hurry off of her steam box, and the placenta was able to come out. So the placenta released almost immediately after, sitting over the steam. So really incredible how quickly and effective that can be. Now that said, there's a lot of times where there is retained placenta, that it's unknown that maybe the placenta, a piece of the placenta stayed inside. Or maybe it's known the placenta stayed inside, but then it's still, like you have to wait for it to pass, right? So that's where that steaming in the postpartum, those immediate days postpartum, can help those pieces of placenta release. And that's what postpartum steam users will sometimes report. It's like, oh my gosh, I'm finding pieces of my placenta, and also what like midwives with their clients are seeing and able to confirm that sometimes pieces of the placenta are released with that postpartum steaming, and those immediate days postpartum clearing out that lochia can often clear out any retained matter like that placenta, which all decreases the risk of hemorrhaging, which all decreases the risk of mortality. Okay, so the partially retained placenta presents a hemorrhage risk, and kind of like with the miscarriage, I cannot believe how many partial placentas are coming out when people postpartum steam. Like, I just cannot believe it. Like, it doesn't seem like everybody is really getting their full postpartum cleanse. And I think this is because, especially with medical births, you have almost no care, after the person goes home from the hospital for 6 weeks, and then even at the 6-week checkup, I don't know if there's really any questioning that would catch, that there is retained placenta at that time. We really have to look at the lochia and what's happening with the uterus and the contractions to understand whether or not you're getting that full uterine cleanse. Yeah. So then another emergency situation where steaming could be used as first aid, like in the delivery room, is when the bladder doesn't empty. So if the person's bladder doesn't empty, then they have to be catheterized and may be sent home with the catheter or may not be sent home because of that. But then the catheter itself poses a risk of infection. Okay. So, we had a case where one of my friends she couldn't empty her bladder. And so again, we called the steam practitioner, sent them to the hospital. Now, Nava talking about how a steam practitioner in the hospital, the steam practitioner said she had her box and she was in the elevator and she said everybody was just looking at her like she was insane. She went right into the room, she put it down, she set up. And when the nurses and doctors cleared the room, she was like, okay, come on, you know. And so she had the client sit on the steam sauna, and the client immediately was like, help me to the bathroom. And so helped her to the bathroom, and she immediately was able to empty her bladder, right? So really important, you know, again, a first aid situation people might not think about, only maybe my practitioners know about this, but I want the world to know about how important it is to have the ability to steam in the labor and delivery room for these type of first aid situations that, you know, again, this isn't something you can deal with days later. Like the bladder can't wait a couple days until you're released from the hospital. You have to be able to deal with it right then and there. And it's very effective. To me, a much better option than having to use a catheter, okay? And then the lochia infection. I talked about my own experience with the lochia infection. Anytime that there's a lochia infection, again, steaming, and, you know, with the lochia infection, antibiotics would be used. Well, we use antibacterial herbs, you know, and so it's something that can be tried. And then, you know, I don't know if so I'm not an expert in this area, but when it comes to antibiotics, there then becomes a question of the milk, you know, and whether the person can breastfeed with that milk. And so with the steaming is not going to impact the milk one way or another. And, you know, any birth workers here who know more about that, feel free to chime in. But I think that there's one that you can use and still nurse, and then there's another maybe that you can't, or maybe there's none. Maybe you pump and dump. I'm not sure, but either way, all I know is if you're taking some type of pharmaceutical drugs, it introduces another, you know, another layer of complication, especially when it comes to nursing. So being able to treat that lochia infection with antibiotics without having to use the pharmaceuticals is great to know that that's possible. And it can be done, again, within 24 hours. You know, you can really knock that infection out. And then the last one I'm going to say, where steaming can be used for emergency first aid. Somebody said, what is there that steaming can't do? Listen, I don't know. I don't know. I think of it like, and you know, because I really believe in steaming and I talk about using it for all these different things. I don't know if you guys saw that movie, My Big Fat Greek Wedding, where the dad, he has Windex and he uses Windex, you know, to heal everything for every issue. That's how I feel like I am with steaming. I'm just like, yeah, any problem, steam, you know, it'll help it, you know. But the problem is it just does, it helps with everything, you know. So anyhow, okay, so the last one, and this one again, it's like an emergency first aid situation. Like you could, if you have the steam, you could do it. If you don't have the steam, it might be too late, right? Is Plan B pregnancy prevention. And this one I actually will give you guys the steam plan with it. Is that if somebody is inseminated and they want to use, and they're not trying to get pregnant, I actually do not recommend the use of steaming for abortion at all. 100% no. It poses a hemorrhage risk. However, right after sex, you can use steam to clear out as much of the semen as possible, okay? And then you can continue to steam daily until that period comes. And in this case, like I really recommend, and mind you, just general steaming, you wanna do 10 minutes, unless you've been screened by a practitioner to steam longer. But in the case of Plan B, you want to steam for 30 to 40 minutes. Now, this may cause certain people to, if they have excess heat problems. I mean, if you have the chance to talk to a practitioner, talk to a practitioner. But in general, the period may come, like, you know, if you steam that long and steam with the wrong herb, but use any herbs. If you want to get your period to come, then you can get your period to come by just really laying on with like long steams and herbs. And everybody, please, I really always want this to be done under the guidance of a practitioner, but this is a situation where steaming can be used as emergency first aid. And, you know, somebody might contact me a week later and it's just like, oh, darn, you know, that's a week, you know, you really want it to be used immediately. And I really hope to see this become more accessible when responding to, now, of course, there's all kinds of situations where you get intimidated, or even could be your husband. You're like, oh, shoot, like, I'm not trying to get pregnant right now. But specifically when it comes to responding to sexual abuse and rape cases, I really wish that this was something that was offered and used. Again, we need those obstetric nurses and those obstetric OBGYNs and those rape crisis centers, you know, to be able to respond to this kind of thing. So Kimba says, I'm a midwife's assistant nurse and doula. Thank you for all your service. Kimba, I work so much. I'd love to have the recording and take the certification if I can afford it. That postpartum study was great. So valuable. Thank you so much. Okay, wonderful, Kimba. And, you know, I do have scholarships available for people of color, women of color. So go check that out at steamychick.institute and apply to my scholarships. And even if it's not accessible after the scholarship, send me a message. Because again, for me, what's most important is that this is something that is accessible. All right, so the final thing that I said I was going to tell you is how steaming can decrease risk of maternal mortality. And I think that we've covered enough that hopefully I can do this in 5 minutes, okay? So in the World Health Organization has been collecting information about maternal mortality to see what the top causes of it are worldwide. They report that in 2010, there were 287,000 maternal deaths worldwide, okay? So when we have to look at the causes of these, okay? So 27% of these cases were hemorrhage, okay? 27%. And sorry, to credit my source, this is from a study from the World Health Organization called Global Causes of Maternal Death, a WHO systematic analysis by Lancet Global Health, published in 2014, okay? So hemorrhage was recognized as it was 27% of the cases. So when you look at steaming, if steaming is being used in labor and delivery, you have if retained placenta, you have, you know, reduces the risk of hemorrhage. And then you have the partially retained placenta, reduces the risk of hemorrhage. So right then and there, you are having it as something that's accessible is something that can be reducing the risk of mortality, okay? Then I also want to say with the hemorrhage, with the miscarriages, I think not incomplete pregnancy loss recovery, like not actually having the full miscarriage recovery is something that also leads to this hemorrhaging and this hemorrhage risk. And they actually put pregnancy loss as 8% of the indicators. So they actually put together, they lumped some things together, but I'm just going to say pregnancy loss overall were 8% of the cases. So 27% hemorrhage and then 8% pregnancy loss cases. And some of those pregnancy loss cases, again, were due to hemorrhaging. So something pretty, you know, again, women are safer when steaming is around and when there are steam therapists who know how to use steaming in these different situations, okay? Okay, the second one is eclampsia, or what they call hypertensive issues or heart issues, okay? So that high blood pressure, okay? So eclampsia is what happens, you know, once the blood pressure is out of control and the person, you know, dies, okay? So that preeclampsia, that high blood pressure, again, what we found in the study, and that was one of the studies that floored me. When all these studies, all these stories I hear about steaming all the time, nobody is ever like, and my blood pressure, you know, people aren't really telling me about their blood pressure. I was floored when we did the 4-trimester vaginal steam study, and our entire steam group's blood pressure had come down. Each individual and the entire group, the average, had come down so far and come back to what is normal. Whereas our non-steam group, poor things, all of their blood pressure had gone up, you know. And then that eclampsia, you have to understand, is a problem during pregnancy, but it's also a postpartum problem as well, okay? And this study was looking at mortality, I believe, within 16 days postpartum of giving birth, okay? Sepsis accounted for 11% of the mortality rate. 11% of the mortality rate was sepsis. Sepsis is basically a really bad infection, usually a bacterial infection, okay? And the main causes were wound infections. So again, when somebody has a wound that didn't heal it properly. So we also got to look at stitches when it comes to this. And then retained pregnancy matter. These are the reasons for sepsis. There are others, but these are the two main reasons for sepsis. So look at that steaming. Look at our STEAM group in the 4th trimester vaginal steam study. By day 8 was at their final stage of lochia. They only had a tiny bit of lochia left and they were at their final stage, versus that means that they were at less risk for any lochia infection or any retained, pregnancy matter, would have already cleared out, right? Whereas our non-STEAM group was still dealing with lochia, and you'll see that there was a big difference in how quickly the lochia cleared out for our STEAM group. So that reduces risk of infection. And then also the vast difference that the STEAM group had with their stitches, with the pooling and the tightness and the burning, all of that with the stitches had gone down so much for our STEAM group, and that our non-STEAM group was still dealing with it at the 6-week mark, right? So that again decreases risk of infection, of mortality. So then delivery complications they have as 10%. And I had a hard time understanding what delivery complications were, what they were including here and weren't. But basically cases where cesareans go wrong or medical interventions go wrong are lumped into this 10%. Okay, so the things that are happening, for example, when you look at what's happening in the Czech Republic, and that the people who are steaming aren't transferring and aren't having to have as many medical interventions, we're dealing with the less interventions, the more that the birth can progress, without, any interruptions, and, happen how it's supposed to happen without the need for intervention, the less you're dealing with risk of mortality. Okay, so that's all I'll say there. And then embolism. Embolism is another one, which is basically an obstruction of the uterine arteries. And so usually due to a blood clot, but it can also be from the amniotic fluids. So the increase in circulation, the steaming absolutely causes an increase in circulation, right? And that's, and we know this, we see this, you see the difference in your period, you see that fresh red blood, that this caused, basically an increase in circulation. So to me, if steaming is being done as pregnancy, as labor prep, and then for postpartum, you're increasing and helping with the blood circulation, and therefore decreasing the chance of embolism. All right, and then the other 28% were indirect causes, so other things that happen that people die from, like car accidents, but while pregnant, okay? And then, the last one I was gonna say was pregnancy loss, which was 8%. So again, we already talked about several cases of, the using steaming to help with the pregnancy loss recovery helps to reduce issues. Okay. That's it. That's the whole talk. Those were all my notes. Thank you guys so much. Okay, I took an hour and a half. I want to leave you guys, letting you guys know that there are more resources about all of this information at my website, steamychick.com or steamychick.institute. Okay, one will lead you to the other. If you are interested in taking any of my classes, scroll to the bottom of the screen. You will see the application to apply for a scholarship, but you will also see an enrollment widget that gives you the option whether you want to sign up for one class or a bundle of classes or the full certification programs. I have 2 levels of the certification. Level 1 really teach you all of the basics about contraindications and sensitivities and how to make herbs, and even the history of steaming and how to use intake forms and all of that kind of stuff, and specific intake forms for steaming. Okay, really wonderful. We supervise each practitioner, and also people don't pass unless they actually pass the exams and pass the practice supervision, the supervised practice client. So what you want to understand is that my practitioners are very highly trained. They go through a lot, and they have to pass those exams and have a proper setup before they get certified. So the other thing is to find my practitioners, go to the Steamy Chick directory. Okay, so there's a STEAM practitioner directory. Okay, so again, you can find that when you go to the website. Okay, so my level 1 practitioners are very well trained as far as being able to administer steams, and they do a lot of general steam plans just for general health, preventative health, and maintenance. Okay. Now my level 2 practitioners, and it takes about 2 to 4 weeks to get through level 1. My level 2 practitioners are more highly trained. It's about a 6-month to 2-year long program, and they really learn all the ins and outs of women's health, from the anatomy and how the steaming impacts the anatomy to the ovarian cysts and polycystic ovarian cysts and all the different kinds of infections and all the different kinds of fibroids and how steam impacts each one of those and how to create steam plans tailored to those. Okay, so the level 2 practitioners are also where we go in with the postpartum and the pregnancy loss and the fertility. Okay, so it's a big program. Okay, but unfortunately there's no skipping ahead. You need to have level 1 and then level 2. So consider that, whether or not you just want to have a steam practitioner that you refer to, or that you just can refer your clients to, or whether or not you actually want to take that on. But one of my biggest questions is, hi, I'm a birth worker. Can I go into the postpartum class? I already know how to use steaming. And it just doesn't work with this program because of how thorough I train all of my practitioners. And the basis for all of the postpartum class is based on level 1 and the earlier classes in level 2. Okay. Yeah, you guys, I really believe that me plus all of you, all of my homies, can really get the word out there. I feel like there's nothing like I think there's 500 women who signed up for this webinar. I really feel like when 500 women know anything, I feel like everybody all the women in the world could know it, So that's why I do these, so that we can really spread the word. And then for all the birth workers out there, I just want you guys to know, I really do thank you so much for your services that you offer, and that you're there for women. And when looking at the accessibility of steaming, you all are the ones, you guys are the ones that are really getting it to people faster than anybody else. So that's why I had a webinar specifically for birth workers. All right, you guys, thank you guys so much. I love you all. Mwah.